Welcome back, viewers. India is now under the grip of an influenza virus, and according to sources, 6 people have already died due to the influenza caused by the H3N2 virus. 1 death was recorded in Karnataka's Hassan district. Cases were also reported in Punjab and Haryana as well. Now, this death comes a day after Karnataka Health Minister Dr Sudhakar dispelled fears surrounding the virus. And so far, according to reports, over 90 cases of the H3N2 virus have been reported in India. The rising cases of the flu-like virus are becoming a cause of concern in the country. Joining us live is Dr Sitesh Roy, an immunologist. Dr Sitesh Roy, thank you for joining us on this broadcast. First up, what are the symptoms that the people must be wary of when it comes to the Influenza A virus?
So Deepak, thanks for having me. Influenza A, very much like the other respiratory viruses, has typical symptoms of fever, sore throat, body ache, cough, cold, and in some cases it can even cause nausea, vomiting, diarrhea, and give a bad headache to people. So the symptoms are not unlike other respiratory viruses, and it's very easy to misidentify it and just pass it off as a simple cold and cough, where it can get pretty bad if the patient has a weak immune system or is an asthmatic or has diseases like diabetes, heart disease, chronic ailments. In them, these diseases can potentially turn fatal. COPD and ILD are another diseases in which even a simple influenza infection can turn fatal.
Now, doctor, what can the people do in order to stay safe from this influenza?
So I think it comes back to the same protection that we had during COVID. We have to wash our hands. We have to be careful about wearing masks, especially when we are in crowded places or amongst big groups of people while traveling. It is also important to not touch our face or mouth when we are in public areas and make sure that we are sanitizing. And besides all of this, influenza vaccination is probably one of the most important steps, which in many parts of the world has been recommended for anyone above the age of 6 months. But in India, we definitely recommend it for the elderly and anyone who has any. Taking the influenza vaccine can certainly protect them from such fatal episodes and reduce the severity and the intensity of the infection.
Well, doctor, how big of a concern is this for the people of the country? Because India's population is huge, and even a slightest of infection in a highly populated state could prove to be very, fatal for the people, right?
You're right, Deepak. Generally, influenza does not cause fatalities, but still, according to the WHO, as recently as last year's data, about 6.75 lakh deaths across the globe are attributed to seasonal influenza infections. We don't have data for India, and I'm sure that there are a lot of people who go into the hospital with influenza, pneumonia, or some complication of influenza because they are already have a weakened immune system or have other chronic diseases, but are never tracked or reported as influenza because testing is not done enough. You need a PCR test or a rapid influenza test to diagnose this disease. And so I think we are underestimating the cases and we are underestimating the deaths significantly. And I think everyone needs to be very careful and take care of their health with a good diet, lifestyle, exercise, and everything else that keeps us fit and our immune system healthy.
Well, doctor, in Hassan as well, an 82-year-old man died to this influenza. Does this virus affect, people who have underlying ailments or, the critical age group?
Absolutely. It has been found that above the age of 60, and as we go higher than 60, 70 or 80-year-old or 90-year-olds, they tend to have a much more severe course at times with influenza. And what may be passed off as a simple cold and cough in a younger individual can become, as I said, a pneumonia or even lead to a almost like an ICU admission, ventilators, cytokine storms, everything that we saw in COVID. Influenza can do the same. Remember that influenza, what is called the 1918 pandemic, took 5 crore lives back about 105 years ago. So this is certainly something that affects the elderly and those with chronic diseases, diabetes, heart disease, chronic kidney disease, as I said, lung diseases like asthma, COPD, ILD. It affects them a lot more than people who are otherwise in a healthy state. But it's estimated that even a totally healthy individual can have a very severe influenza A infection.
Right, many thanks for joining us with all those details, Dr. Roy. Now, people got to remember that this too is similar to COVID-19, and masking up and hand hygiene is as important as, avoiding large gatherings in when you go outside. Now, viewers, it's time for us to switch our focus to Kerala. Now, even as the waste